You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
Well, good morning. Welcome back to Insurance Matchmaking. I am your host, Matt Libby from Matt Libby Insurance. If this is your first time listening, hopefully I won't be boring you. But just a little history, I guess. Like I said, you could be a first-time listener. I have been in the insurance business since 2013. I'm a retired Army helicopter pilot and former elementary school teacher. So those are some things I did before I got in the insurance business. Actually got in the insurance business leaving a assistant manager job at a convenience store in Knoxville. Very well-known chain of travel centers, so headquartered in Knoxville without naming names. But decided that really wasn't what I wanted to do. And so it's kind of funny. I answered one ad on Indeed. I thought it was something else, but it was actually about insurance. So I didn't catch it was insurance when I first started, exploring the ad. But decided that wasn't the way I wanted to go. Not with that one. And then I saw another ad and said Aflac likes to hire veterans. I thought, well, okay, I hadn't thought about insurance. Let me give this a go. And I did Aflac for a year and wasn't having success there, and decided I started looking for jobs. I just knew I didn't want to get back into the retail world and work those kind of hours. I was looking for 9 to 5s. My wife was working, had a good job, and I had my Army retirement, so I wasn't as desperate as some people would be of, hey, I've got to get a job right now. So I kept doing the Aflac thing and was ready to get out of the business, and met a gentleman named David, we both lived in Oak Ridge at the time. I'm now in Cookeville. He lives down south in Pikeville, which is actually, I don't know how close to, but where Elijah lives also. If you've met Elijah here on my show. But he said, no, we got this company, we do health insurance, and this Obamacare thing is launching, and we've got thousands of people just right here in the Knoxville area that we can help, and everybody has to get insurance. And he decided he was going to open an office in Oak Ridge, and like I said, I lived in Oak Ridge. I said, okay, if you open up an office, and the reason I said have an office to go to with Aflac, I was driving around to businesses trying to get my foot in the door, so I was burning up gas and time trying to make a living at that and wasn't succeeding. And so anyway, David got me recruited in with the group I was with there. I don't know if I want to say their name here. I'm not trying to be negative. I'm just, again, when you say company names and you put it out on the airwaves, they can say, wait a minute, we didn't approve you to use our name. So I'm not going to use that name right now. But so we had a year, we shared an office. And a great thing shared for me was I wasn't paying rent. He and I did a couple of newspaper ads together. That was kind of his way of me paying rent. And problem was we were right next door to dog groomers. And we listened to the dogs yapping and whining all day long. I mean, our clients could actually hear them over the phone when we were talking to them. And so it's like, yeah, that location wasn't the best location. It was good, cheap rent. People were able to come and find us. It was, it was on a main road and easy access to, so that worked out well. So that was in 2014. So I had somebody ask me a question the other day about health insurance, and I was like, well, prior to the ACA, or also known as Obamacare, I didn't have any experience as a healthcare agent, and really didn't have much experience with health insurance because, as I said, I retired from the Army. I had my TRICARE. So I didn't deal with insurance the way most people did with either getting private insurance or getting insurance through their employer. I mean, that mine was kind of through my employer, but it was, it's different than if you work at a factory or an office that provides insurance. So that's what I started doing. And I haven't looked back. When we moved here to Cookeville, I was pretty sure I was probably going to go independent. The company I worked for, and maybe you've heard me if you listen on here a couple times, we have a term, it's called LOA, which it stands for License Only Agent. And I think it's really a terrible nomenclature. It just means that the agent works under an agent, and they assign their commissions to the agency, and then the agency pays their commission from there, and so that's how it works. So I have the agents that work with me, and then I pay them as a 1099. And that's the way I was with the previous company. I was an independent contractor, and I got a certain share of what was spent in premium as a commission, and the company took, they took their little bit off the top. I decided I wanted to do more of the Medicare education, lean more towards the Medicare supplement, or also known as Medigap, and not just do Medicare Advantage, which seemed to be more the focus of my previous company. So I had kind of started branding myself here in town as a agency, as my name as the agency, and not depending on the corporate name. And went independent I guess it was in 2022. And then in 2023, we formed an LLC to become officially an agency. And very ironically, it doesn't say insurance anywhere in the name of the company. We actually are ALM Marketing, which I'll get stuff in the mail for ALM Marketing, and it's like, no, the L and the M are capital letters. And ALM is our kids' initials. And ironically, and we had a blended family, but ironically, they are alphabetical in birth order too. So ALM. And so that's the name of the agency, but we do business as Matt Libby Insurance. And so that's the name I've been branding. That's one of the reasons I've adopted this radio show, is to be able to get my name out there and get the education out. Yes, I hope everybody who listens to me will do business with me or refer business to me. At the end of the day, hopefully I am educating folks on their insurance needs, and that's one of the reasons why I named the show Insurance Matchmaking. I want to help match you to the insurance that fits for you. And I've had, what we call P&C agents, property and casualty. That's your home and auto people. I don't do that. So I've had some of those type people on here. I've had mortgage people on here. I've had financial people on here, because those are all kind of insurance related, and hopefully we can match those things. So anyway, that kind of brings me to one of the things I want to talk about, and I think everybody's talking about right now, is AI. So we have, what's his name, Dr. Oz, who is the administrator or director. I'm trying to think CMS administrator. CMS is for the Centers of Medicare and Medicaid Services. There's two M's there, but there's only one M in the acronym. But wants to have AI take over helping people on Medicare. And a lot of agents, in my realm, or where is the AI going to take our jobs, or what's our future with AI taking over everything? I guess maybe because I am 67, so I know I'm not going to be trying to do this for the next 20 years, but I'm not worried about it. And I had somebody in this week that has an email address, but he says, I don't do email. So the people in my age group, and those turning 65, which is the bulk of my market right now, still a lot of people, they don't do a lot online, and they're very distrustful of AI. So I feel pretty secure that my business model of being that person that you can sit down with and go over your options, and we figure out what works for you. We can talk, and you can share your experiences with me so that I can say, oh, no, yeah, if we just put the raw data in here, yes, this is a plan that would probably be recommended for you. But what you told me about this of your family, or this happened 10 years ago, let's not go that route. This is not going to be probably the best fit for you. Let's go this way. So, and that's one thing. You're not going to get that from AI, because AI is not going to pick up on the nuances of what your life experiences have been. They're just going to be data. You're going to put in your date of birth, your height and weight, what medications you take, what's the names of your doctors, all the demographic stuff, and then it'll spit out here's our solution for you. Well, as I said, they may not know that full solution. The other thing is, sometimes as we get talking, people forget, then they start talking about dental insurance, and we find, yeah, this plan isn't going to work with your dentist. If you want to keep your dentist, we're going to have to look at a different solution. So those are those little things. Like I said, I'm not terribly worried about AI taking away from me. In fact, I've been using AI for a lot of things. One of the I've talked about the education. One of the things we're working on, just trying to get it put together, is the workshops that I do. Had one last week in Crossville, got one coming up, or actually, when you hear this on the radio, I will have already held one on Thursday here in Cookeville, but got some others scheduled in the future also. But I do those in person, and then generally the people come to my office later, and then sit down and go into what their issues are, what their individualized assessment, not just the 30,000-foot view, but working on putting together a video on that. And it's something that will end up setting up a webinar for people to come online and participate in the webinar and get the information, the alphabet soup of Medicare and how it works. That's hopefully going to streamline my, as we say, lead flow, my inbound clients. And so, yes, we're going to use some AI tactics in that. I mean, generally, anytime you advertise on Facebook, you're using their algorithms. Well, the algorithms, that ties into AI. But I've also, we're working on the slideshow and wanting to do some images, can take a photo and say, well, replace this person with another person, or did one, it was like, got a lot of, I'm one of those people that, has a lot of clutter on my desk, but if I cleaned it all up, then I wouldn't know where things were. But I took a photo and said, change the color of my shirt, clear off, I just said, clean up the I can't remember the exact wording, but basically, clean up the desktop. It just took everything off the desktop. And the ironic thing was, where I had in the original picture, I'm sitting with a laptop, and then I have my additional monitor that's on the right-hand side of the desk, or to my left. And when the AI recreated the image, put the keyboard at my hands, and then moved the monitor over to the right-hand side, or the left-hand side of my desk to my right. So I thought, okay, but it made sense. The desk color looked the same. It just was a clean surface. I have some bookshelves to the side and had some things sticking out of the shelves, and it basically just took everything off the shelves, put the bookshelves. And what I really liked about it was the quilt that my wife made that sits behind my head, which has our company logo on it. It did a real good job of not changing that quilt and making sure it stayed in the picture. So that worked out really well. So yes, AI is going to do a lot of things for Medicare, and I think it's going to help. But the AI has also been some of the issues with Medicare Advantage, and that has to do with the prior authorization things. And I think I'm going to probably go into that a little bit more after the break. I realize we're getting close to our commercial time, and so I'll be breaking up the show here in a moment. And so we'll continue our conversation about AI. As I mentioned, we're already kind of past the dates for the Welcome to Medicare. The other thing is, if you weren't able to make one of these Welcome to webinar sessions, you can always schedule a time to just come in and have us do it and go over it with you. You can just call the office. Amy will get you on the calendar, and we can go through that. And then hopefully here real soon, it'll be, hey, you call in, we'll send you a link to say a video copy of the webinar, and that gets that education. And one of the reasons we do that, not only does it get me in front of more people, but when I do sit down with them to go over their issues and their needs, we've already covered an hour's worth of education that I don't have to spend that in that appointment. We've already covered that. So anyway, we're on the break. I went a little over what I was going to, and we'll be right back.
For 75 years, Twin Lakes has been connecting the Upper Cumberland, from the very first landline phones to today's 100% fiber network. Now they're celebrating 75 years of keeping you connected. Join them at the end of March and throughout April at each of their Twin Lakes customer service offices for anniversary celebrations featuring cookies, swag, and 75 chances to win a $100 gift card at each event. Find a full list of office celebration dates on their Facebook page. Twin Lakes, connecting the Upper Cumberland for more than 7 decades. Dreams are built one home at a time, and you can help make them real. Join Upper Cumberland Habitat for Humanity for the Putnam County Dream Builders Luncheon, March 24th at Live Church in Cookeville. Social hour starts at 11:30, lunch at noon. Tickets are just $25, or become a table host for $400 and make an even bigger impact. Join the Dream Builders Luncheon and support affordable housing in our community. Reserve your seat now at uchabitat.org.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, and we're back on Insurance Matchmaking. I was talking about the workshops, and that's one of the reasons, too, as I mentioned, I want to go ahead and get that video set up, because one of the things is, if you want to come in and you got questions, you're turning 65, you got questions about it. And I've got clients who are turning 65 and they say, hey, it's coming time. I'm ready. I'm going to be ready to go here in a couple of months. I can just send them that video and say, hey, we'll set up a time to get to talk, but before we meet, please watch this video. And it will help cover and answer a lot of questions before we even sit down. And I'm pretty sure you're still going to want my help on certain things, but it definitely will help streamline. One of the things I cover a lot in the workshops, and is part of the webinar video, is if you are, and I've mentioned this on the show before, but it bears repeating, that if you're getting close to that 65th birthday, if you are drawing Social Security, any form of Social Security, whether you're receiving spousal benefits, you started your Social Security sometime after the age of 62. Or you went on disability because something happened, you got hurt, you got sick in your working years, and now are drawing Social Security disability. Once you have Social Security disability for 24 months, in month 25, you will be put on Medicare. So any of those things happening, or sometimes people, maybe at age 63, they started drawing disability sometime, so they're not quite 65 yet. They haven't been on it for 24 months. But when they turn 65, Social Security goes ahead and enrolls you in Medicare. And this is what confuses a lot of people. You can go to Medicare.gov, and there's some links to go and to get signed up for your Medicare, but it actually links you to Social Security. Social Security is who verifies your eligibility for Medicare. So like I said, if you're already drawing a check, some form of a check, doesn't, like I said, it can be any, whether it's disability, spousal, survivor benefits. If you're drawing Social Security, when you turn 65, they will send you your Medicare card. If you're not drawing Social Security and you don't have employer insurance, you are going to have to sign up for Medicare at 65. In the actual Medicare, you can't sign up for that until 3 months before your birth month. But if you're working on an employer plan, you can defer signing up for that Part B and paying that Part B premium if you choose to stay on your employer insurance. And we'll go more in depth, and I don't want to spend a lot of time on that, just kind of reiterating that. Because sometimes it makes sense, even if you're working, to not keep your employer plan and go on Medicare. This cost can actually be less going the Medicare route. So that's one of the things we can handle in those one-to-one assessment meetings. So that's the big, but the downside, just kind of reiterate, is you do have to sign up through Social Security to get your Medicare started. If you aren't drawing Social Security because you're waiting to age 67 and you're waiting then to retire from your job, you're going to have to pay that Part B premium directly, and unfortunately, they're going to charge you for the first 3 months and have it set up for quarterly billing. But the good news is once you've paid that first 3 months, you can set up a monthly draft for that, but you you're going to get hit with the big bill up first. And if you're already drawing Social Security, it will automatically come out of your Social Security, and you won't have to worry about paying 3 months at a time. So, and I probably went on that a little longer than I meant to, and that's something we can help with. And there are different ways to sign up for that Medicare when you're turning 65, and we can help guide you on that. It's pretty easy to do online, other than if you haven't ever signed into Social Security, you do have to go for the login.gov or ID Me. You have to set up that verification process, and then you can sign in to your Social Security account and sign up for your Medicare. And it goes fairly quickly, and I think people have been getting pretty good results. It was slow when I did mine. It was like almost a month before. It was 20-some days before I got my Medicare number, and it was a full month before my Medicare card showed up in the mail. But I do know people lately who've been doing it, and their card shows up 2 weeks later. So it seems to be going a little quicker. Not sure what made it more efficient, other than maybe people are working a little more efficiently to make sure they keep their jobs. So that's how that works. We're in a little bit of a transition right now, so I may not be using all the same carriers I've been using because I'm in the process of changing my hierarchy. A couple of weeks ago, I talked about the group training I went through in Nashville, and working with this group, and decided that, yes, it makes sense for them to be my agency hierarchy too. And I know if you're not an insurance agent, you probably don't know what I'm talking about, but most of the insurance companies I work with, I can't just go to that company and say, hey, I want a contract, and I'm going to start selling your policies. So we usually have to go through, some type of intermediary. And in our line of business, we typically call we call that a FMO, a field marketing organization, but they can also be an IMO or an NMO, which they're kind of a higher level, but they're still the same thing. I'd say they're the same thing. The process for my agency and myself to be able to get contracts goes that way. So I'm actually adding a new company, and so I probably be kind of, when we first kind of get going, be focusing on that one. It has a lot to offer. It has, Medicare supplement. It has the annuities, final expense, life insurance, cancer plans, those kind of, then the hospital indemnity plans. So very well-rounded, a lot of things you've probably heard us talk about here on the radio, and it fits into those umbrella packages, as I've talked about in the last couple of weeks, is filling those gaps of Medicare. We always talk about a Medicare supplement being a Medigap plan because it covers those gaps, those built-in gaps of Medicare, such as the deductibles, in the fact that there's no maximum out of pocket. There's co-insurance for some things that the Medigap plan will cover. But the one thing, I don't know if say big shortcoming, but one of the things that a Medigap plan doesn't do is it will not pay anything for non-Medicare approved expenses. And those non-Medicare expenses can be travel expenses, experimental treatment expenses, going to somewhere that doesn't take Medicare. Not every medical provider accepts Medicare. Now, most do. I mean, it's probably 98% of the providers in the U.S., but also some people have gone out of the country for care. I was talking to somebody recently that had a nice little all-expense-paid, I shouldn't say all-expense-paid trip, but it kind of was, trip to Costa Rica, because the air travel to Costa Rica, like week in a resort hotel, and her husband's dental implants, that whole package costs less than him getting those dental implants here in the state. And I know I kind of jumped gears from cancer and medical treatment to dental implant, but it's kind of that example. There are a lot of clinics in different countries. Who was it? Somebody mentioned something about going to Thailand for dental. So I know it was one of my clients recently that if you need a lot of expensive work, the air travel, you still could come out ahead than what you'd spend for it in the States. But your insurance is going to cover any of that. So that's where it's handy to have those other insurances. And I say that, I know I keep going back to dental, but that's where, especially like with a cancer coverage, is those non-Medicare approved expenses, or it doesn't even have to be non-Medicare. I mean, you don't have to wait till your Medicare age to get cancer coverage. In fact, I recommend you get it at a younger age, because that's one of those plans that generally, when you get that plan in place, those rates don't go up. So if you can get for you or for your family, if you're not Medicare age, it's a great idea to get that coverage in place. And some of them have, especially like I said, talking about when you're getting it for a family. If you're in your late 20s, early 30s, maybe got one or two kids, you can get a family plan very inexpensive. It covers you, your spouse, your children, and if you have another child, they just get added to your plan. It's a family plan. It's not it's this much for 3 children, but if you have 5, it costs you this. No, it's going to cost you the same. Now, I have seen some plans that, like, if you do have more than 5 children, they do start adding a little bit on for each child. But most plans, it's just, single parent, individual, couple, single parent, or family. And that's the rate. Those plans, after 20, 25 years, will return your entire premium minus any claims you've had along the way. And when I say claims along the way, they don't necessarily have to be that you had cancer and you cashed out some of those expenses. It can be, some of them have, like a wellness benefit. If you get your annual cancer screening, they'll pay you $50 or $75. It's probably going up now for some plans. So that would be considered a claim, that whatever they paid out was good. So it would reduce that a little bit. But it's still, you're gonna get, at least 90% of what you've paid in premiums back on that plan. And that doesn't necessarily cancel the plan. You would still continue to pay premiums, but you get that 25 years back. Or if you pass away before that time's up, it will work kind of like a life insurance policy and pay that out, the premium spent, to a beneficiary. So you're putting the money in something for protection. The thing is, if you ever need to use the benefits, you'll get back way more than you ever put in. But if you have that return of premium, you'll get your money back eventually. You're not going to see it in 3 or 5 years and have a return on investment, so to speak. But if you are in it for the long haul, again, you get it when you're in your 20s, your 30s. It's not going to be that expensive, and you set that up on an automatic bank draft. After a while, you kind of forget you're paying it. It's just there. But if you ever need it, it's priceless. So that's some of that I'm talking about in the cancer. The other thing I want to cover, we're almost out of time here, is cancer, heart attack, and stroke plans. And now getting sidetracked here. I generally don't necessarily recommend as much heart attack coverage as cancer coverage if you're Medicare age, because you're generally not going to have as much out-of-pocket expenses with a heart attack or stroke. I mean, stroke could be because you could have a lot of ongoing disability, but like a heart attack, yes, you're going to have some therapies. You're going to be unable to do things for a while, but you generally kind of recover and not going to have, and you're usually not going to travel for treatments. Where with cancer, there's that strong possibility of even going out of the country, and you have ongoing treatments that are very, and drugs that are expensive there. So the expense may not be quite as much, your burden with a heart attack or stroke versus a cancer diagnosis. The other thing is, I mentioned that the new company you're going to work with, they don't have a cancer, heart attack, or stroke plan. They have a cancer, heart, or stroke plan. And the reason I stress the heart part is, if you have to get a bypass, you get stents, it pays out for things like that, where a lot of the other plans only pay out the heart part is if you have a heart attack. So I think that's going to be a neat plan. I don't know a lot about it yet. I probably will maybe dedicate another show to just talking about that plan. But we're running out of time here. As always, remember, stay tuned to Grace 107.7. We're here Saturday mornings at 10 o'clock every week. And remember, at Matt Libby Insurance, we can cover you from head to toe. It doesn't have to cost you an arm and a leg. And we'll talk again next week.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.